What is the primary function of bone marrow? Your options are fat storage, hormone secretion, blood cell production, or calcium regulation. The correct answer is C, that is blood cell production. Bone marrow is the main site of hematopoiesis, which is the production of red blood cells, white blood cells, and platelets. It also maintains essential blood components needed for immunity and oxygen transport. Question number 2. Which type of bone marrow is primarily responsible for hematopoiesis? Your options are yellow marrow, red marrow, spongy marrow, or compact marrow. The correct answer is B, that is red marrow. Red bone marrow contains stem cells that produce blood cells. It is highly vascular and actively participates in hematopoiesis. Question number 3. In adults, red marrow is mainly found in which bones? Your options are long bones only, flat bones only, flat and irregular bones, or all bones equally. The correct answer is C, that is flat and irregular bones. In adults, red marrow is predominantly located in flat bones such as the pelvis, sternum, and vertebrae. Long bones mainly contain yellow marrow. Question number 4. What does yellow marrow primarily store? Your options are blood, calcium, fat, or protein. The correct answer is C, that is fat. Yellow marrow stores adipocytes, fat cells, serving as an energy reserve. It can convert red marrow under certain conditions like severe blood loss. Question number 5. Which type of stem cells are found in bone marrow? Your options are epidermal stem cells, hematopoietic stem cells, neural stem cells, or cardiac stem cells. Correct answer is B, that is hematopoietic stem cells. Hematopoietic stem cells in red marrow give rise to all types of blood cells. They are essential for replenishing blood and immune cells. Question number 6. Hello friends, welcome back to Dear Competitive Exam YouTube channel. Today you are attending 100 most repeated and most important question answer session based on bone marrow for your upcoming exams. And this is the part 1 of this series. So let's challenge your quality of learning. Let's see what will be your score out of 50 from this part 1. So do watch this video completely to make yourself more fit to answer any kind of questions. And at the end, if you find this video helpful, then please do like, subscribe and share this video to all your friends who are preparing for upcoming any kinds of medical exams. Let's continue. Question number 6. Bone marrow biopsy is usually taken from which side? Your options are tibia, femur, iliac crest, or radius. The correct answer is C, that is iliac crest. The posterior iliac crest is the most common and safest site for bone marrow biopsy due to its accessibility and rich marrow content. Question number 7. Which disease is commonly diagnosed through bone marrow aspiration? Your options are pneumonia, leukemia, asthma, or tuberculosis. The correct answer is B, that is leukemia. Bone marrow aspiration helps to identify abnormal proliferation of white blood cells, which is key in diagnosing leukemia and other blood cancers. Question number 8. What color is healthy bone marrow typically? Your options are dark blue, yellow or red, white or green? The correct answer is B, that is yellow or red. Yellow or red. Red marrow appears dark red due to blood content, while yellow marrow looks yellow because of fat. Color may vary with age and health status. Question number 9. What change occurs in bone marrow as people age? Your options are: red marrow increases, marrow turns to cartilage, yellow marrow increases, or bone marrow disappears. The correct answer is C, that is yellow marrow increases. With age, red marrow is gradually replaced by yellow marrow, especially in long bones. This reduces the hematopoietic activity. Question number 10. Which of the following cells are not produced in bone marrow? Your options are: erythrocytes, leukocytes, osteocytes, or platelets. The correct answer is C, that is osteocytes. Osteocytes are bone cells formed from osteoblast, not from blood-forming cells. Blood cells like erythrocytes, leukocytes, and platelets arise from marrow. Question number 11. Bone marrow is part of which body system? Your options are: digestive, respiratory, skeletal, or lymphatic and skeletal. The correct answer is D, that is lymphatic and skeletal. Bone marrow is a vital component of this skeletal system and also plays a major role in the immune lymphatic system through lymphocyte production. Question number 12. In children, red marrow is found in only flat bones, almost all bones, only skull bones, or only pelvis. The correct answer is B, that is almost in all bones. Children have red marrow in nearly all bones to meet high blood production needs. With age, it gets replaced by yellow marrow. Question number 13. Which vitamin is necessary for proper functioning of bone marrow? Options are: vitamin A, vitamin K, vitamin D, or vitamin B12. The correct answer is D, that is vitamin B12. Vitamin B12 is essential for DNA synthesis in red blood cells production. A deficiency can cause megaloblastic anemia. Question number 14. Which condition is characterized by failure of bone marrow function? Your options are: osteoporosis, aplastic anemia, leukopenia, or thrombocytosis. The correct answer is B, that is aplastic anemia. Aplastic anemia is the failure of bone marrow to produce adequate blood cells. It leads to pancytopenia and requires urgent treatment. Question number 15. Which blood component is derived from megakaryocytes in the marrow? Your options are: neutrophils, red blood cells, platelets, or lymphocytes. The correct answer is C, that is platelets. Platelets are cell fragments that originate from megakaryocytes, large cells present in the bone marrow. They aid in clotting. Question number 16. Bone marrow transplantation is often used to treat osteoarthritis, leukemia, anemia due to iron deficiency, or fractures. The correct answer is B, that is leukemia. Bone marrow transplant replaces diseased marrow with healthy stem cells, commonly used in leukemia and lymphoma treatment. Question number 17. Which of the following does yellow marrow not produce? Your options are white blood cells, red blood cells, platelets, or it produces none. The correct answer is D, that is, it produces none. Yellow marrow mainly stores fat and does not actively produce blood cells. It may revert red marrow into extreme blood loss. Question number 18. What type of tissue is bone marrow? Is it muscular tissue? Is it cartilaginous tissue? Is it connective tissue? Or is it nervous tissue? The correct answer is C, that is connective tissue. Bone marrow is classified as specialized connective tissue due to its support and production roles within the skeletal system. Question number 19. Which test is used to evaluate bone marrow function? Blood culture, bone scan, complete blood count (CBC), or bone marrow biopsy? The correct answer is D, that is bone marrow biopsy. Bone marrow biopsy is a direct method to assess marrow structure, cell production, and detect diseases like leukemia or myeloma. Question number 20. Bone marrow contains which of the following immune cells? Your options are macrophages, lymphocytes, lymphocytes, or all of the above. The correct answer is D, that is all of the above. The marrow harbors various immune cells including B cells, which mature their macrophages and precursors of T cells. Question number 21. Bone marrow necrosis can result in increased oxygen levels, bone softening, bone cell regeneration, or severe pain and blood abnormalities. The correct answer is D, that is severe pain and blood abnormalities. Bone marrow necrosis can cause sharp bone pain and disrupt normal blood cell production, leading to anemia and infections. Question number 22. What is the main source of stem cells for bone marrow transplants? Your options are liver, skin, umbilical cord blood, or brain. The correct answer is C, that is umbilical cord blood. Umbilical cord blood is rich in hematopoietic stem cells and is commonly used for pediatric transplants when bone marrow match is unavailable. Question number 23. Which of these diseases directly affects bone marrow? Your options are cirrhosis, rheumatoid arthritis, multiple myeloma, or glaucoma. The correct answer is C, that is multiple myeloma. Multiple myeloma is a cancer of plasma cells that originate and proliferate in the bone marrow, damaging the bone structure. Question number 24. What is pancytopenia? Options are high WBC count, low platelets only, reduction in all blood cells, or bone marrow hyperplasia. The correct answer is C, that is reduction in all blood cells. Pancytopenia is a condition where red cells, white cells, and platelets are all decreased, typically due to marrow failure or suppression. Question number 25. Which of the following is a myeloproliferative disorder? Your options are diabetes, polycythemia vera, hypertension, or hepatitis. The correct answer is B, that is polycythemia vera. Polycythemia vera is a bone marrow disorder where too many red blood cells are produced. increasing blood viscosity and risk of clots. Which of the following cells mature in the bone marrow? Your options are T lymphocytes, neurons, B lymphocytes, or erythrocytes. The correct answer is C, that is B lymphocytes. B lymphocytes mature in the bone marrow and play a crucial role in antibody production. T lymphocytes mature in the thymus. Question number 27. What stimulates red blood cell production in the bone marrow? The options are insulin, erythropoietin, cortisol, or serotonin. The correct answer is B, that is erythropoietin. Erythropoietin produced by the kidneys stimulates red blood cell formation in response to low oxygen levels in the blood. Question number 28. Bone marrow failure can lead to hyperglycemia, pancytopenia, hypercalcemia, or hemophilia. The correct answer is B, that is pancytopenia. Bone marrow failure results in reduced production of red cells, white cells, and platelets, a condition called as pancytopenia. Question number 29. Which type of leukemia affects the bone marrow? Your options are all, tetanus, anemia, or HIV. The correct answer is A, that is all. Acute lymphoblastic leukemia is a cancer of immature white blood cells that originates in the bone marrow. Question number 30. Which condition involves increased production of immature white cells in bone marrow? The options are hemophilia, leukemia, lymphoma, or thrombosis. The correct answer is B, that is leukemia. Leukemia is characterized by the uncontrolled proliferation of immature white blood cells in the bone marrow. Question number 31. What is the function of stroma in bone marrow? Your options are oxygen transport, nutrient absorption, support and microenvironment, or muscle contraction. The correct answer is C, that is support and microenvironment. Stromal cells in the bone marrow provide structural support and regulate the environment for hematopoietic stem cells. Question number 32. Which of these is a common sign of bone marrow suppression? Your options are fever, itching, low hemoglobin, or high blood pressure. The correct answer is C, that is low hemoglobin. Which bone is least likely to contain active red marrow in an adult? Your options are sternum, pelvis, skull, or femur shaft. The correct answer is D, that is femur shaft. In adults, the shaft of long bones like the femur usually contains yellow marrow, while red marrow is confined to flat bones. Question number 34. What is the role of macrophages in bone marrow? Your options are reduce insulin, absorb fats, support hematopoiesis, or activate bone growth. The correct answer is C, that is support hematopoiesis. Macrophages in bone marrow help clear cells debris and regulate stem cell activity, contributing to healthy blood cell production. Question number 35. Which of these does not originate in bone marrow? Your options are monocytes, platelets, neutrophils, or T cells? The correct answer is D, that is T cells, mature form. T cells originate in the bone marrow but mature in the thymus. Other blood cells mature within the marrow itself. Question number 36. Which of the following conditions can lead to bone marrow fibrosis? Your options are iron deficiency, vitamin D detoxicity, myelofibrosis, or gut. The correct answer is C, that is myelofibrosis. Myelofibrosis is a bone marrow disorder in which scar tissue replaces healthy marrow, affecting blood cell production. Question number 37. Which type of cancer affects plasma cells in bone marrow? Your options are lymphoma, multiple myeloma, carcinoma, or melanoma. The correct answer is B, that is multiple myeloma. Multiple myeloma is a malignant proliferation of plasma cells in the bone marrow, impairing immune function and causing bone lesions. Question number 38. What is the role of mesenchymal stem cells in marrow? Your options are form RBCs, support skeletal muscle, differentiate into bone and fat cells, or transport oxygen. The correct answer is C, that is differentiate into bone and fat cells. Mesenchymal stem cells can develop into osteoblast, chondrocytes and adipocytes, supporting bone and connective tissue development. Question number 39. Which hormone indirectly regulates marrow activity by promoting erythropoietin production? Your options are calcitonin, testosterone, parathyroid hormone, or aldosterone. The correct answer is B, that is testosterone. Testosterone stimulates erythropoietin production, which boosts red blood cells production in the bone marrow. Question number 40. What causes hypoplastic bone marrow? Your options are excessive exercise, autoimmune response or chemotherapy, obesity, or dehydration. The correct answer is B, that is autoimmune response or chemotherapy. Hypoplastic bone marrow has reduced cellularity due to conditions like autoimmune disease or the effects of chemotherapy. Question number 41. Which imaging modality helps to detect bone marrow abnormalities? X-ray, MRI, CT scan, or PET scan? The correct answer is B, that is MRI. MRI is sensitive detecting changes in bone marrow composition, especially in cases like infiltration, edema, or necrosis. Question number 42. Bone marrow transplant requires blood type match only, HLA compatibility, age similarity, or same gender. The correct answer is B, that is HLA compatibility. Human leukocyte antigen HLA matching is essential for transplant success to reduce graft versus host disease. Question number 43. Which of these can stimulate bone marrow to produce more white cells? Iron, erythropoietin, GCSF, that is known as granulocyte colony stimulating factor, or vitamin D. Correct answer is C, that is GCSF. GCSF is used medically to stimulate bone marrow to produce neutrophils, especially after chemotherapy. Question number 44. Aplastic anemia is diagnosed by, your options are liver biopsy, serum creatinine, bone marrow biopsy, or CT abdomen. The correct answer is C, that is bone marrow biopsy. Aplastic anemia is confirmed by a bone marrow biopsy showing hypocellularity or lack of blood cell precursors. Question number 45. Hypercellular bone marrow means bone tissue replaces marrow, increased fat, excess blood forming cells, or scar tissue in marrow. The correct answer is C, that is excess blood forming cells. A hypercellular marrow shows increased hematopoietic activity, and it is often seen in leukemias or reactive marrow states. Question number 46. What does the bone marrow release during an infection? Antibodies, platelets, white blood cells, or hormones? The correct answer is C, that is white blood cells. During infections, bone marrow increases production and release of white blood cells to help fight the pathogens. Question number 47. Bone marrow involvement is common in which cancer? Colon cancer, lymphoma, breast cancer, or brain tumor? The correct answer is B, that is lymphoma. Lymphoma often spreads to or originates in the bone marrow, affecting lymphoid cell production. Question number 48. Bone marrow aspiration is done using a syringe, bone drill, Jamshidi needle, or glucometer? The correct answer is C, that is Jamshidi needle. A Jamshidi needle is a specialized instrument used to aspirate marrow and perform biopsies safely. Question number 49. Reticulocyte count helps assess liver function, immune strength, bone marrow response, or blood pressure? The correct answer is C, that is bone marrow response. Reticulocyte count indicates that rate of RBC production, reflecting how actively the bone marrow is functioning. Question number 50. Bone marrow is located in which part of the bone? Periosteum, epiphysis, medullary cavity, or articular cartilage? Correct answer is C, that is medullary cavity. The medullary cavity found in the center of bones houses the bone marrow where hematopoiesis occurs. Friends, it is a time to comment your score out of 50 questions. And friends, thanks for joining us on this exciting journey. If you enjoyed the quiz and learned something new, then give us a thumbs up and let us know in the comment section. And don't forget to subscribe and hit that notification bell so you never miss out on our upcoming exploration of fascinating topics in the medical field. Until the next time, stay curious, stay healthy. See you. Take care.